Tragedies happen sometimes in nursing homes, and Governor Mike DeWine says they can be caused by systemic problems in those facilities. He's praised the $1.4 billion in the new state budget for nursing homes to provide incentives for increasing quality of care and for more inspectors. But the budget also increases penalties for facilities that fail to provide quality care. I talked with the executive of the lobbying group that represents 1,300 skilled nursing facilities, assisted living communities, and other providers.
That money goes towards increasing the rates for providers, but a lot of it is targeted in various ways to things that are tied to quality measures. A significant portion of the dollars are tied to specific measures from the Centers for Medicare and Medicaid Services, so they're federally specified. That has been the case for a while, but this is a major investment in meeting those measures. And then there'll be more of the measures that will come into play next year in the second year of the budget. There are also several other provisions in the budget that are directed to different measures of quality, if you will, or attempts to try to enhance quality. For example, there is going to be, going forward, assuming that CMS approves this, there will be a additional payment for private rooms. So, sorry. So there'll be an additional payment for private rooms, which is certainly something that we view as being quality, or a way of looking at quality. I know that if I was going into a skilled nursing facility or any kind of congregate setting, I would certainly prefer to have my own room than to have a roommate. So that's one example, and even within that, there'll be a requirement that if you're a one-star facility or you're on the special focus list, which are the kind of the lower levels, then you can't get this enhanced payment for private rooms. A similar kind of provision with respect to the ventilator payments. Providers that take people on ventilators, which are obviously really expensive to care for, get an enhanced rate. But going forward, they won't be able to do that for new ventilator admissions, if they are, again, a one-star building or a special focus facility or on the special focus candidate list. So those are some examples of some of the things. There's other provisions in there as well, but really from the very beginning, even before the administration got involved in the budget for skilled nursing, there was a lot of focus on, how can we enhance quality. Another area that comes to mind is really ramping up the requirements to acquire a skilled nursing facility. So currently we have what's called CHOPS, changes of operators, and there's not a lot of requirements around that, and that's going to be significantly increased under the budget bill.
When we talk about the budget going to increase quality of care, does that mean that there's a problem in Ohio's nursing homes?
Well, I guess that's all in the eye of the beholder. I think the governor felt that there was, as he indicated in his State of the State speech back in January. But we can always do better. For example, when we look at the national numbers, our staffing numbers aren't great in Ohio. It's just a fact. And that's tied to reimbursement. If you don't have the money, you can't hire people. And there's also, challenges in finding people, but that's true everywhere. So the fact that we're lower is not great. So we're very hopeful that the additional funding that this, as you said, it's a significant amount of additional funding that's coming to skilled nursing, is going to really help us to be able to hire more staff, pay the staff that we have a better wage, and really improve the workforce, and hopefully move up on those rankings. Staffing is also going to become one of those. I'd mentioned that there would be additional quality measures coming in next year, and staffing hours per day is going to be one of those added measures.
What happened with Medicaid reimbursement rates? You told my State House News Bureau colleague Jill Ingalls last year that nursing homes wanted those rates raised based on new cost data and also to be based on the lowest half of nursing homes what they're paying, not the lowest quarter of nursing homes. So what happened with those Medicaid reimbursement rates?
It was a little bit of a mixed bag. So what we had proposed, you got that correctly. We were proposing that it be based on the median for both direct care and ancillary and support, which are two different components of the rate. But both of those components are largely made up of staff, of employees, and the cost for those individuals. So it went through a lot of permutations through the course of the budget process, but the end result was that the direct care cost center is going to be at the 70th percentile, so well above the median. But the ancillary and support is not being rebased at all. So it'll just stay the same amount that it currently is, which unfortunately doesn't recognize the cost increases in that category. And ancillary and support includes people like people who work in the kitchen and serve food to the residents. It includes the activities people. It includes social work. It includes laundry and housekeeping, maintenance, all kinds of things that are necessary for quality of life, but aren't the direct hands-on caregivers like the nurses and nursing assistants. That those folks are in direct care.
DeWine had said that the money includes funds to dramatically increase the number of nursing home inspectors in the state. What does that mean? Is there a number attached to that dramatically word?
No, and we actually met with ODH last week, and that was one of the topics we asked about. And quite frankly, they're having trouble filling even the existing positions that they have for the same reasons that our members are having difficulty filling their positions. It's hard to find staff, and their wages aren't great at the state. So they declined to say how many additional people they might be adding with the additional funding. There is some more funding in the budget for hiring surveyors, also hiring ombudsmen, and some other things that are kind of on the not on the reimbursement side, but more on the regulatory side.
You've said that nursing homes, some of them are still recovering from the pandemic. There's been a lot of cost recovery. There are people, though, who have family members in nursing homes who would be surprised at that because of the costs. They've seen the bills, they've seen the cost of nursing homes. The nursing home industry also gives a lot of campaign contributions, especially to Republicans, $1.4 million in the 2021-2022 cycle. So is the increased money in the budget a reflection of the need that nursing homes have, or is it a return on campaign donation investments?
Well, obviously, we do play in the political arena. There's no question. We're not ashamed of that. But we also spent a lot of time going back to last year, really, and into the nursing facility commission that the legislature had in really educating them, because the reality is that there are lots and lots of folks who play in the political arena, and they all have their own needs or requests that come into play in the budget process. So in order to make a good case for that, it can't just be, okay, we're friends with particular legislators or a group or a large number of them. We also have to make the case of why this funding is needed. There's only so much to go around. We had more this year than usual, but there's only so much to go around, and you've got to be able to make your case with reason and also with the needs of Ohioans. So here we're talking about very vulnerable people this really goes across the spectrum of long-term services and supports that we represent, not just skilled nursing, but everybody is experiencing the same kinds of things. Costs have gone up, whatever business you're in, but particularly if you're serving people, the number of caregivers have gone down. They're fewer than they were prior to the pandemic. So we've got a story to tell, and we've got people who really need service. They're very vulnerable. So you put those two things together: the increased costs and who we're serving, and who ends up kind of paying the price for it all. It was a convincing argument, I